is Bonnie White. I'm a pediatrician. I retired 2 years ago after 40 years in practice. I live in Ponte Vedra, and I was in private practice for 40 years, loving every minute of it. Raley was my right-hand man.
So I'm Raley Moore. I'm clinical coordinator with Emmanuel Project of Northeast Florida. Like Dr. White said, she and I had worked together a little over 11 years at her practice.
We worked together for quite some time, and I realized that medicine had changed directions to more of a business than taking care of patients, and that's not why I went into medicine. So I went into work with Raley sitting next to me, and I wrote my resignation letter, and pressing that send button was one of the hardest things I ever did, because I knew I was giving up a passion of mine. And I was home for 2 years playing and enjoying my grandchildren before I started working at the Emmanuel Project.
So Emmanuel Project has our mobile unit, we call her Emmy, and she has 2 rooms, 2 bathrooms. She's large and in charge when she pulls up to any event, so we can't miss her. We set it up outside where we check in, and we take them into 2 different locations. We can do sort of lab work there. We can check urines on people. We can do glucose testing, cholesterol, sort of the point of care tests. We have the 2 exam rooms, so we can be in an exam room with the door closed, and we're just sitting and listening to the patient, and it's really just sort of like 2 little medical office rooms with a center area where people can sit and wait. Our doctors are under sovereign immunity, so everyone has to be uninsured is our qualification, uninsured or meet the federal poverty guidelines. And that has just changed a couple months ago. So we're 300% or below federal guidelines. And that is for a family of 4. For the household making under $77,000, you qualify for our services. I think a lot of people don't realize that when you say you're going to underserved areas, you're talking about the low income people that have a roof over their head and they have a job.
People that work in the fast food industry. We have people that we had a gentleman who was manager at one of the gas stations, and he said, I have insurance for my kids, but I don't have insurance for myself. It's a gamut of different people that will come. Retired people who, don't have insurance anymore. It truly is a wide range of families from all walks, people that have recently moved here, single moms who have either left abusive relationships back in another state, or spouse has passed away, and they just don't know where to get care for their kids, and they're doing their best to survive.
We had a woman come in one time that her husband had 3 kids. He was the primary breadwinner. They got down to 1 car because it was comfortable. He worked from home. Was heading somewhere one night. He got killed in the car wreck. The car was totaled. Now you've got a mom with no family, no support system here, single parent. Life can change just that fast. But it's an hour till their closest doctor's office, or they don't have any providers locally. They have all gone, hospitals have closed or doctor's offices have closed. So there's an lack of access to the healthcare. That's a whole nother issue with the rural community. They have to take off work, take off the whole day, and it's an hour plus to get to the healthcare. They may be sitting an hour there. So that's a couple of
transportation.
Lacking transportation to get to the healthcare.
Well, and you realize how expensive everything is.
Yeah.
Too, and this one mom who was trying to get the Social Security card for her grandchildren, she said, if I spend the money on gas to get back to the Social Security office for the umpteenth time, then I'm going to have to sacrifice feeding my kids, and then I'm going to have to try to find a food bank where I can make sure that I can adequately feed them. So understand that they, again, her husband is working, but just not making enough to make ends meet. And you understand the dilemmas that they have. Do I pay for gas to get this Social Security card, or do I use that money that I was going to pay for gas to get food for them for dinner tonight?
Do I get health insurance, or do I feed my family for the next week? I mean, so you've got, it's a constant struggle on trying to make sure everybody stays healthy,
right,
and then has to be able to have the resources to be able to provide the health care that your family needs. And you've got to choose feeding your family or paying for health care. We do pediatrics, which is something that a lot of nonprofits don't really cater to, pediatrics. Some of the services we provide at Emmanuel Project is back to school physicals. We also do blood pressure monitoring, nutrition, weight loss. We treat the whole body, not just the symptoms of a patient. We also do a lot of referrals and mental health.
Well, we have some people that come in with acute issues, fevers or chest pain or high blood pressure or abscesses, if they're homeless, skin rashes. So we see acute stuff as well as people that come in because they haven't been seen in a year and they have high blood pressure. So we're dealing with a hypertensive person who might have renal issues, or they might have a heart murmur or an issue with their heart. So it really is a gamut from acute stuff that is easily treatable, and then the other stuff that we need to refer to a specialist to see them, or to get an ultrasound, or a woman who comes in with a breast nodule or something that needs to be ultrasounded. I see some kids with cavities that need to be treated. And again, we just don't have that dentist to refer to. But for the children, it's, cavities. A lot of them are younger, and we know the teeth, their baby teeth that they will lose. But, you want it addressed and looked at before it turns to something like a root canal. And we just, it's very difficult to find dental.
And with the Medicaid too, people that are on Medicaid and had it, and then it's been taken back from a lot of people in the community, being able to have the internet, to be able to go back online, to sign up for Medicaid again if there's an issue or paperwork needed, or if you work full time, you can only do it at work, or you don't have a job where, so there's so much more to it to just apply for Medicaid. And then if you have a full-time job and you have 3 kids, but you make too much money, that's a struggle. So you can't afford to pay for private health care, but Medicaid, you make too much money. So we see a lot of that too, that people are struggling to just meet in the middle to be able to have the support they need. Learning about the families that meet the ALICE criteria, it is not just the low-income people or the people that live in the rural areas. It's people, just normal people that make too much money to be able to provide Medicaid for their family. But if you get a raise in your work, you can kick all your kids off if you have Medicaid.
Obviously, we need more physicians in the areas that are underserved, and more physicians that are willing to see patients that either don't have insurance or have the Medicaid insurance. Make it available to these patients so that they can come in. Obviously, if they don't have transportation, which seems to be a big issue, transportation needs to be provided for people to get where they need to go, so they're not spending money on gas that they need to be spending it on other things to help them survive. As well as we need the specialists, I think, to be able to see these patients. If we could get specialists that would come to the area versus, again, the family having to drive to to one of the tertiary centers. If we can find someone that, has an opening that can see this child, whether or not it's for, again, asthma or blood pressure or heart issues, or even an ophthalmologist or dental care. We just struggle sort of finding that.
come with us. Come with us just one time out there to see what we're doing in the location, in the neighborhoods, and to see the relationships we're building with people, to be able to have the community trust us. I think part of what our job is to show people, we like live by example, what we do, who we serve, to be able to help people see what's going on out there. I mean, you can tell people about, come look, this is what we do, people we serve, but until you see it firsthand, you really, I try to live by example, help the next guy, and inspire somebody else to do the same. The more people that help, the more the communities improve.